Okay, so I'm sitting here with Anne Jensen, and it is evening for me in Costa Rica. It is tomorrow for you in Australia. Zoom is an amazing thing. And I'm really glad that we get a chance to connect and talk here because I've been putting together Kinesio Geek magazine for like 5 years now. And your Oxford studies that were showing the validity of muscle monitoring were featured in the very first issue that we had
I
because,
didn't.
yeah, it was exciting to be able to kind of put that out there. And so now it's like it's a few years later, and I know that you have another really interesting project in the wings, and I was hoping we would get a chance to talk about that and let people know what you're up to. So, without any further ado on my part, do you want to tell us a little bit about your new project and what's going on?
Yes, it's a project, a study that I conceived of when I was doing my PhD at Oxford. But at that point, I had already done maybe 5 studies, and it didn't need to be done then. So we kind of shelved it, but it's really interesting in that because I come from various muscle testing backgrounds. I am not just like, yes, I took applied kinesiology as a chiropractor, but I do more than applied kinesiology, and I obviously do heart speak, which uses a different type of muscle testing. And then I'm a chiropractor, so there's a different type of muscle testing again. I got to see a whole range of types of practitioners, especially when I was assessing people for my data collect for my PhD. And I would invite any practitioner, any muscle testing practitioner that wished to participate. And so I had all sorts, not just kinesiologists, not just chiropractors, not just all sorts, some psychologists and social workers and acupuncturists and osteopaths, you name it, they showed up. And I got to see what they did during interacting with them, and I assessed over 400 practitioners, their accuracy. And also with teaching heart speak around the world, people come to my classes from various backgrounds as well, and I could see what they were doing. This person would be doing things differently to that person, and those people over there were testing 2 hands, and this person over here only did the O-ring test. And so it was fascinating to me. It is still fascinating how people are using this amazing tool. So my new study is, well, for my old studies, I looked at the accuracy of muscle testing to distinguish between a true statement and a false statement. And the paradigm that we used during that research was one that I used in practice. I used in practice myself, and it was, if a statement is true, the arm will stay strong, the muscle will stay strong. If a statement is false, the muscle goes weak. But that led me to thinking about how different people were using it, and there's a lot of people out in our community that do yes and no. They test for a yes and a no, but not everyone tests the same way. Sometimes the yes is a weak, and sometimes the yes is a strong. So this is what the new study will look at, is if we change the initial paradigm, is the accuracy comparable? So I am going to ask practitioners to test both. If using the paradigm, if the true statement results in a strong test, false statement results in a weak test, like all my other studies, but then also switch the paradigm. I'm going to then ask the practitioners to have the intention that a true statement will result in a weak test, and a false statement will result in a strong test, which actually some people out there do. It will be interesting. That's basically sums it up.
Okay. So, I mean, I'm listening to what you're saying, and when I teach kinesiology classes, I'm always telling people that in kinesiology, context is king, right? The framework that we have set up changes what it means, right? And so I'm thinking even about what you're saying there, because when I'm working through a normal session, I work from a locked muscle, which would mean that I'm looking for an indicator change, which is the muscle to unlock most of the time, unless I'm working with muscles specifically, like I'm working with a reactive paradigm or something like that, in which case I might be looking for the things that are strong. Like there's a whole
Right.
lot of different ways of testing, and the context changes it.
Yeah, so this might be a good time to talk about the different types of muscle tests, because I'm hearing that I think we might be using two different types. You start with a locked muscle. So let's back up. So there are, in my experience, there are three different types of muscle testing being done in clinical practice. One of them is the strictly orthopedic neurological testing that chiropractors use, osteopaths, physios, testing muscles to detect whether or not the muscle strength has been impacted. And that type of muscle testing was systematized by Florence Kendall and her husband Henry, and they systematized that, and they graded those muscle tests 0 to 5, where 5 was normal, and they were looking for muscle strength. And a normal strength muscle, well, obviously would be graded a 5, and they would compare side to side, and they would test any muscle in the body. So that's the Kendall style. Then there's another style, which was the George Goodhart style. And in the 60s, well, he was a chiropractor, right? So he tested muscles like most chiropractors do. And he noticed that when certain conditions were present, certain muscles were weak. For example, when the pectoralis muscle, when the heart was a heart condition, maybe the pectoralis muscle was weak. So he tested there. And, that makes sense because the heart lies over the pectoralis muscle. And for instance, that's what I learned as well. So long story short, we all know that George Goodhart developed from that applied kinesiology. And applied kinesiology tests, in applied kinesiology, any muscle of the body is tested, and it's looking for a weakness. So, you test both sides and you compare them as well. But George then also changed the 0 to 5 scale to a binary test, meaning it's either strong or weak. In AK, we say facilitated or inhibited. Inhibited meaning weak. And from there, then in the 80s, 70s, late 70s, John Thea then took applied kinesiology and then made Touch for Health. And then from there, a wellspring of different techniques were created. Some of them which still use the AK style of testing. There was something really unique as well about AK style of testing, and that is this was the first time a muscle was tested to detect something other than strength. So if we back up all the way to what a test is, a diagnostic test, a test tries to detect a condition, the presence or absence of a condition. And it's used to guide the course of care. So, so that's unique in that AK. And then, that's all common sense, right? That's all what we know, right? Is that?
Yeah.
That's
And
all
I mean,
kinesiologists.
the truth is that I use all three styles at varying points depending on what I'm doing, right? Less of what I would call more the sports kinesiology, like the Kendall and Kendall stuff. This muscle is weak. We need to do something to strengthen this muscle. But when I'm working with athletes and people that have actual like physical injuries, sometimes that is what we're doing. So yeah, like I find that all of these are here and you can kind of float through them depending on what you're doing at the moment.
Yeah, okay, cool. So then we fast forward into the 1980s and we notice a divergence of how people are using muscle testing. In fact, I've been heard call it various things like the arm pushdown test, indicator muscle testing, things like that. Now, that kind of testing is the type of muscle testing that I studied during my PhD at Oxford. And it's basically choosing one muscle and testing it over and over and over, and as the target condition changes. Now, this is where it gets really interesting. Now, when did that start? The earliest time I found this was, well, it got popular in the 80s, but if we go all the way back into the 30s, 40s, there was a chiropractor by the name of Major DeJarnette who developed a technique called SOT, sacro-occipital technique. And in sacro-occipital technique, he used what is called the arm fossa test, which is basically an indicator muscle test. So a patient would be lying, so in chiropractors, we chiropractors call patients and kinesiologists call them clients, but regardless, patients lying on their back and they would put an arm straight up in the air, and the practitioner would then test as they were testing parts of the pelvis and the different fossas, upper, lower, right, and left. So a weakness would be indicative of what's called a category 2 block, indication to category 2 blocking in SOT. So that's the beginning of the indicator muscle testing. So let's fast forward again to the 80s, and because it was like, oh, this is so cool, everyone should learn to muscle test. So from Touch for Health, and then you could see all these different types of muscle testing emerging. And it seems like the psychologists and those types really then just did indicator muscle testing. And then there was a whole group of muscle testing techniques that did indicator muscle testing. Now, I've come to call this muscle response testing. Now, muscle response testing tests whether a muscle stays strong or goes weak. It is a binary test, like the AK style of testing. But the thing is, you're usually only testing one muscle over and over again. And you can basically test anything under the sun. So for a test to be different, there has to be distinct differences. And the three different types of testing, they're distinct. One, the Kendall and Kendall style uses test any muscle of the body, testing for strength, and 0 to 5 is the outcome. AK style, any muscle of the body, change to a binary, so it's strong or weak, but also testing for things other than strength, like organ dysfunction, meridian dysfunction, neurovascular issues, etc. So we're testing for other things. So it's those two types of testing, even though they look the same, are completely different type of tests. I know it's confusing, but that's how it is. And then we have muscle response testing. We're testing one muscle of the body, and already that's different. So already it's a different test. It's binary, and it's testing for pretty much anything. So, having said that, then So then we go back to what are you testing for? That's always the question I ask kinesiologists or muscle testers. What are you testing for? What are you testing for? And it's really interesting answers I get. For example, I would expect a heart speaker, anyone that I've trained in heart speak, to say, I'm testing for stress. Yeah. So.
Okay. I had never heard that before about the stuff from the chiropractor in the 30s. That is a new piece of history for me, so I'm excited to look that up actually.
He also, Major Dean Arnett also then, I haven't been able to ascertain when he started doing what's called the mind language testing. And mind language is like a quick way to determine how we use the blocks. So it's this patient would stand upright, put their right arm out to the side, and it's basically, testing that as we touch 3 different areas: category 1, category 2, category 3. So there's the arm fossa test, which is a type of muscle response testing, because it's using one muscle as we change, and it's also binary. And also the mind language testing is also a type of muscle response testing. So if anyone SOT practitioners out there listening or let me know when Deidre Arnett started using mind language, because I can't find that information.
Okay. So I'm curious because we've talked at length now about the different kinds of muscle testing, and anybody who's been attending some of the Knowledge open houses that I've been running the last few months, we actually talked about this a few months ago, because the question came up in one of the groups about, how strong is a muscle test, right? How do we test muscles? Because in Touch for Health, we are taught 2 pounds of pressure, 2 inches, 2 seconds, right? And that's a muscle test. But are there times when I have the experience often when I'm working, I know the second I touch someone that muscle's going down, right? Like I don't need to push at all or for 2 seconds. That's a test. Or if you're working with, again, resetting reactives or something of that sort, you might need more force in the test. So we got into this whole conversation about it. And so I'm curious to hear from you. Why is it important to really understand and break down the differences between these 3 different styles?
Why is it important to understand that there's 3 different types of muscle testing?
Yeah, like for the average person who maybe has only been trained in one modality, what do they need to understand about this? What do they need to take out of it?
I would say that they need, the most important piece of information is that muscle testing does work, and yeah, it works. And it's not and we also, another, if I may, we have to stop questioning it. Just let's get beyond it. Okay, it works, let's just move on and to see how it works. I don't really care how it works, but in what regard does it work? Does it work, where does it work best? Does it work best for supplement testing, or how well does it work for supplement testing? What are you using it for? Well, I'm using it to I don't know, whatever people use it for. And that's the next step in our research agenda, I think, is to determine if what we're doing in clinical practice actually results in better patient outcomes, not just on a one-off case. Yeah, okay, it worked for that patient. It works for that patient. But I would love to see some research done on clinical trials on specific conditions like irritable bowel syndrome, or whatever, what's your specialty?
Right.
Or learning difficulties. Pick something that you're really confident in, that you're in practice, and design a study and try it. Choose some people that are, have that condition, and do X, Y, and Z on that person, and then don't do that on this person. Maybe do something else. Maybe look at some other aspect and see if there's a difference. See if there's a difference in group A and group B.
What you described is actually what I've heard as being the problem with doing studies in our industry before, because, okay, let's say irritable bowel syndrome, because that was something that you just mentioned. If I see 20 clients with this condition, every session looks different because I'm not really interested in curing irritable bowel syndrome. I'm much more interested in where is the stress in your body that has allowed this imbalance to happen, and then how do you need that to be balanced. So when you then show this to someone and you go, look, like all of these people had good results, it's like, yeah, but you did different things with each one of them. So does that even count, right? It doesn't prove anything. You haven't shown that anything actually works. And I would argue that what you've shown is that the method works.
That's what we need.
Yeah.
This would be an easy study to do. Easy theoretically. A lot of people have irritable bowel syndrome, and a lot of people take a lot of medication to fix their irritable bowel syndrome. So we could design a study, for instance, that would take, in Australia, I'm thinking, this would be quite easy. Get some GP clinics on board and let the randomize, have the next 100 people that come in with irritable bowel syndrome diagnosis, have them stay the course of the medical treatment, they keep going, but then randomly assign them to a kinesiology protocol, and to see if and regardless of what the kinesiologist does, it's not important. It's kind of what we call a black box experiment, where they just kind of go into the room and then come out again, and then assess them 3, 6, whatever, 12 months later, compare the two groups. How are your symptoms? How are your symptoms? Are there any other symptoms? Are there any other symptoms? That would be feasible.
All right. Well, you and I can sit down and get this sorted, because I would absolutely participate in something like that.
Yeah.
I just want to kind of rein this back in for a second to what we were discussing before. Why, in your opinion, is it important to flip the paradigm and to do the study in the opposite way than you had the first time?
Because it's my hypothesis that it does not matter what you're testing for. What matters is if the practitioner knows what they're testing for. Knows, I'm testing for stress, for example, and what the outcomes will mean. Strong means this, weak means this. So I'm testing for this, and these are the outcomes. It's clear in your head. As long as they are clear in their head, I think we could get that information from the body.
Yeah.
But to be fair, I've seen practitioners not really know what they're testing for. Okay, so this muscle went weak. Well, what does that mean? Could mean anything. You know what I mean?
I do indeed, yes.
Yeah. So I'm trying to get practitioners to become clearer about where they're headed. And I like simple. I don't know about you, I like simple. If it gets too complex, it does my head in. So I think if we can just really simplify things to, you know, the nuts and bolts, I think we can get, I think it will be better utilized. Muscle testing will be better utilized in the world. Where was that? Yes, it was in the course I taught when COVID first started. I taught a course on how to do muscle testing remotely. And that's, I still stand by that. I think that you can take your practice, whatever it is, even if you do applied kinesiology style and say you test all the muscles, you think you can do that and still use indicator muscle testing, whether it's O-ring, this one, or whatever. So why do we need to know, why do we need to switch the paradigm like that? To show that a practitioner's intent matters, full stop.
Perfect.
If they intend this is the results. If they intend that, these are the results. It'd be interesting.
Yeah.
Because we always say it's all about intent. Let's show it.
I mean, I've always done distance. I shouldn't say always done distance, but I've been doing distance sessions for like 10 years. And this last year, more than usual, but not a lot more, because my local clients are still allowed to come see me here. But I work with people all over the world. And I find it especially poignant, the people who I've done physical work for in the past, right? And we're working on things, and they'll say things like, I could feel when you reset the hip. I could feel when you did that thing that you do with my stomach. When you put it back down, I could feel it go. and,
Yeah.
And you know, that's
a whole nother discussion, man. What is
right.
that?
But that's them giving me feedback without me even saying something like, oh, I did this thing. So there's not, it's not even a psychosomatic kind of thing. It's that they noticed a change of some sort and made note of it, which I find very encouraging.
Yeah, absolutely. And you know, we should just kind of don't worry about why it works or how it works or whatever. Clearly it works. Move on. Let's, you know, what else can we do? What else can we do? If that works, well, what about this? You know, what was really interesting with that course is that when people contacted me afterwards, and it goes that, you know, that changed my practice. So it's like I only needed to be shown what to do, that it was possible, and boom, I could do it. Imagine that. Imagine you could just, if you didn't have all those limitations in your brain.
Well, another thing that I've been seeing this last year, because I've been teaching a lot of classes online, and sometimes it's with groups that can't even get together to do practice. So I'm watching students doing their practicing from a distance with each other, and then reporting their feedback and such to the group, which is really powerful as well.
Yeah, that's awesome.
We've segued really nicely here into the next thing I wanted to ask you, which was actually about sort of the role of intention, because a lot of what I'm putting together for this particular issue is about the mind and the role of the mind in our work. So does the mind influence the result of the muscle test, or is it just that the mind needs to be clear about what it's looking for, or what do you think about that?
Yes, I think it does. You know, we muscle testers, we're, I don't know if you've ever been to like a fair or a show or something where there's like stalls and all that, and then there's a guy selling maybe orthotics or magnets, and they'll have you and they'll do the double arm push down test, and then they'll put the magnet on you and then retest, and you're like, oh, look, stronger. I really want to do a study about that will show, have the mindset of being for the patient's highest good versus profit, to sell a product. And I haven't quite figured out the study design of that per se, but I think, that's the intention I have when I do my muscle testing, is for my highest good. But sometimes I do have to stop myself, like, okay, wait. What am I asking here? What do I really want to know? It's for either, whether if I'm testing for myself in my life or a patient for their life, in my highest good, in their highest good, what is best for them. And sometimes, you can be surprised.
Okay.
But I'd love to do a study about profit, or something like that, where practitioners would get rewarded if the muscle test came out a certain way.
Right, and just whether that kind of motivation gums up the works a little bit as far as how clear it is.
Yes.
Yeah.
Accurate
That would
it
be
is, yeah.
interesting. All right. And I'm thinking about that because I've had that experience of having somebody muscle test me like that, and I've been like, I do this for a living, and what you're doing here is not like high quality muscle testing.
Oh, yeah.
When you get kind of like attacked in a store or something like that. Okay.
Yeah, look, it works, Chris. You need this.
Yeah.
Yeah.
Okay.
Please don't do that. Please don't do that out there in the world. I mean, not you per se, but
no, it's the royal we, right? none of us are doing that. Okay. So we've talked a little bit about the kinds of muscle testing, about flipping the paradigm. Any other interesting research and projects that you have on the go right now that you want to talk to us about?
yes. So what I'm finding is that the hardest part of research is actually, once you're started, once you're through ethics, and once you are actually in the data collecting, it is actually getting people to participate. So if you have an opportunity to participate, which is extremely difficult with COVID conditions, because I'm not going to do this particular study online. It's going to be in person. So if you have an opportunity to participate, anyone who's in Australia, because I'm in Australia, any Australians who are listening or reading this, if you want to participate, please put your hand up and we can organize it. So I hope to actually have all the data collection done this year, which might be a bit of an ask, but that's my aim. And then once that's done, I want to do a study on surrogate and self-testing. Now those, I think they're a subset of each other, because I think self-testing, testing yourself, is a type of surrogate testing. You're your own surrogate. So that's exciting. That's my, and I've been planning this for years, a couple of years now, a few years, but now I have the ways and means to do it. And obviously with COVID and distance, it'd be like the perfect thing. So get that underway this year as well.
Cool. So I'm amused because I surrogate test all the time. I mean, that is how I'm working with my distance clients. I work with babies through their mothers and all kinds of things like that. And I trust my surrogate testing for someone else more than I trust literally anything in the universe. Like this is what I do. I'm good at it. There it is. Self-testing, not so much.
Oh.
Like it's the flip, right? And I'm good at self-testing when it's like, this is an emergency thing. I've hurt something and I need to do something to balance that, or I'm sick and I need to take something to be well. self-testing about like my own emotional, mental.
Yeah.
I don't think it's as good as it is for other people. I would so much rather see one of my peers and have somebody else work on me at that point in time. So it's funny because it's the same mechanism, but I trust it very differently in one context than in the other.
So I'm going to be teaching a self-testing workshop at the online Australian Kinesiology Association conference. Don't ask me when that is.
That too, so we'll connect.
There you go. So if, you know, so the way I do it, in that workshop, I'll be teaching maybe 8 or 10 or maybe more different types of self-testing, some of which you probably would be familiar with, maybe some of which you may not be familiar with. And the reason I give you that many is because not everyone likes this type of testing. Not everyone can do this type of testing. So there's other ways to get the information that we need about ourselves. And I do different types of self-testing when I'm doing different things. Like for instance, when I do heart speak sessions online, I'm always surrogately testing like this. This is my heart speak test. But then I found out I was getting confused with this when I was testing supplements for myself, what supplements to take. So I changed, a few years ago now, I changed to the O-ring test for just supplements. So my brain when I'm doing heart speak is in this, and then my supplement brain is with that. So maybe try one type of special testing for supplements, and then one type when I'm doing that, or when I want to know something that, yeah. But yeah, come and pop in and have some fun. It will be a fun, interactive workshop. So.
As long as it's not in the like crazy wee hours for me, I'm going to attend as many of the other presentations as I can.
My goodness, I don't even know when it is. I have to put it on my calendar.
And I will say that honestly, it's more just that I start worrying about my own intentions and my own clarity on them. If there's no emotional charge, like things that there's no emotional charge on are not an issue. It's the things where obviously I'm in conflict over this on several different levels, or I wouldn't be muscle testing for it in the first place. And that's when I think maybe I'm not as clear as I am for other people. So I'll pop in and we'll try some different things and see what happens. Okay, so is there any other resources that you would suggest for anybody wanting to learn more about some of the things we've talked about, the ability to be really clear, the different kinds of muscle testing, the role of your own mind and intention, anything that you want to share with the group?
There is a, I could give you the links. Did I give you the links?
Maybe you sent them in the email, but if you didn't, you could, and then I can put them in with the article and with the interview on YouTube.
Yeah. Okay, so I do have a webinar that I've recorded that explains all my muscle testing research, the PhD research I did at Oxford. I outlined what I did for each of the studies and the results. That's quite interesting. And I think that also will give you links for all of the papers that I've published now. I have to check if it's up to date. There might be one more to add. Anyway, there's that. And what else? What else were you looking for? Sorry?
Oh, really just if there's any interesting resources that you would like to suggest for anyone who wants to read up on this.
It's basically that would be probably the main one, the PhD research information that I've done. You can always go to my website, drannjensen.com, and under the publications tab, those are all my research publications as well. And if your listeners want to participate in my study, Dr. Ann at drannjensen.com, email me and put up your hand. always recruiting. What else?
Could you just really quickly, when you're asking for people to volunteer and you're saying you're recruiting, what do you actually want someone to do in that? Could you
Oh,
summarize it quickly? Because that might make it
yes,
easier for people to know whether they're interested or not.
yes. So what that would involve would be about an hour of your time for this switching the paradigm study. And it will involve you, a practitioner, testing a patient, hopefully that they do not know, and using the arm push down test, the indicator muscle testing, and we're going to use the deltoid again, and that's basically it. So it'll be I think it's 40 muscle tests, both with one, and then 40 muscle tests with the other paradigm, and that's it.
Okay. Interesting. I can't wait until all of this is coming out and we get a chance to look at it all and see what you've come up with.
Exactly, and a lot of people not a lot, some practitioners who participated in my other research said, oh, what's my accuracy? It's not an easy thing to calculate. I have to get all the data, sit down, program a statistical package to calculate it all, and then it spits it out the other end. And I don't actually have to go and see what your accuracy is. It's an actually hard thing. So unfortunately, I can't tell you what your accuracy is. It's not an easy task. But what's really exciting is once this surrogate / self-testing study is done and the system works and I see how it works, I'm going to launch a website that you'll be able to log in and test your own accuracy, and it will give you your accuracy right then and there.
Okay, that's super cool.
Yes, I know. It is so needed. I think you might be
cool.
surprised, like, oh crap, I'm only 86%, I suck. But that 86% would be perfectly fine, don't worry. Yeah, so it's a way to gauge also how you're going, you know. You could use the website to try different things with yourself, you know, with your self-testing. Like, okay, I'm really sucky at self-testing. I don't have a lot of confidence in it. Okay, so I'm going to do this type of testing. That didn't work so well, so I'll do this type of testing. Oh, that worked better, so maybe I'll stick with that. And then what I do is I change my my focus. As long as I muscle test from here, I seem to be a lot better. So you can, I mean, it will be really fun actually, and I'm really excited to do that, but I need to get more information first about how well it works.
I'm just seeing it as a really great tool for new students and for them to be able to see and gauge their progress as they move through classes and as they practice more, and just start to have that confidence, right? And as they can see it improve, I think that would be really powerful for people.
Yes, and it will be really interesting because we know guessing is 50% correct, right? Usually, average guessing accuracy would be about 50-50, right? So if you're better than 50, you're doing good.
All right. Well, thank you so much for sharing all of this with us. I'm going to put all of the links to the publications to the website, and that way people can access all of that. I won't put your email out on the YouTube video, but we'll put it in the magazine. And
Okay.
hopefully some people raise their hands and jump in with you on this new project.
Excellent. Super. Thank you for having me.